Hi everyone, my name's Allison and welcome to the training for those of us who will be administering the survey on drug use practices in the United States with a focus on safer drug use space advocacy. Thanks for taking the time today to watch this training and for administering all the surveys in November. Let's get started. For those of you I haven't met in person yet, my name's Alison Sutter and I'm the student researcher coordinating this study. I live in New York and I'm working on a public health degree. Also, these are my two cats, Edwin and Wallace, who are harm reduction advocates working on naloxone distribution and syringe exchange, and are often featured on the Facebook page Cats of Harm Reduction. Today we'll review a few things to familiarize you with the study. We'll review the purpose of the study, go over the consent form, run through each survey question, and go over steps for storing and returning the survey data once you're done collecting it. The purpose of this study is to collect nationwide data on drug use practices in the United States and understand people's feelings about safer drug use spaces. We'll also assess whether safer drug use spaces will be an effective intervention in the U.S. for reducing the risks associated with drug use and understand how we can work together on national level advocacy for safer drug use spaces. Survey data will be collected between November 7th and November 23rd at sites in California, Colorado, North Carolina, D.C., Massachusetts, Minnesota, New Jersey, and New York. Our target population is people who are at least 18 years old and who have used an illicit drug in the last 3 months. The survey will be conducted by you all via in-person interviews that will last about 10 to 12 minutes each. The survey has 20 questions on it. And we've asked each of your sites to collect 100 surveys for a total sample size of 1,000 participants. The survey will cover several topics, including demographics, drug use, such as type of drugs, how often people use them and where, history of hospitalization, incarceration, and overdose, and attitudes about safer drug use spaces. The findings will be used to guide national safer drug use space advocacy, which many of us are already involved in, and we'll also have city-level data that you all can use for local advocacy work. A quick overview of what each of these surveys is going to look like. A participant will come to your site or you'll meet them during outreach. You'll explain that you're conducting surveys to better understand drug use in the U.S. and help advocate for expanded harm reduction services. You should show them the information form, which I'll be shipping to you in hard copy and you can give to participants. And you'll also go through that form with them to make sure that they understand and can give verbal informed consent. If they agree to participate, you should find a private space like a side room or somewhere where no one can hear the answers that the respondent gives. You'll administer the survey, thank them, they can go about their day, and you will do another survey. We will obtain verbal informed consent before we conduct the surveys to inform respondents of the purpose, risks, and benefits of the survey. And verbal informed consent rather than signed consent forms is going to protect the anonymity of our respondents. When you obtain verbal informed consent, you'll give the participants a copy of the study information form. The key points you should review with the participant and highlight are the study purpose, which is to better understand drug use in the U.S., that the survey is voluntary. They can choose not to participate or can stop participating at any time and stop answering the questions. No personal identifying information will be collected and the survey will be completely anonymous. The survey will consist of a series of questions about drug use and will take about 10 minutes. There's no direct benefit to the participants for taking the survey, but we hope the information collected will help us advocate for improved harm reduction services. And lastly, there are minimal risks involved in taking the survey as we're not collecting any identifying information. Once you've reviewed those points with the participant, you can ask if they would like to volunteer to participate, and if they say yes, you can proceed. You should also please check with the participants to make sure that they have not yet taken the survey to make sure that we get 100 different people at your site. So some basics before we get into the survey questions. Please read the questions as they are written so that every person receives the same survey. Please answer all the questions, even if the person doesn't respond, and we'll go over in a moment what to do if someone doesn't respond. Some of the questions will have prompts in parentheses. This is some additional information you can offer up if someone is unsure of an answer. We'll go over some examples of prompts during the survey questions. Please circle the responses in pen. And again, please don't leave any questions blank. So if someone chooses not to answer a question, you're going to circle the option 9, which is no response. If someone says they don't know an answer, you will circle 9, for don't know. And in some cases, if someone answers a question in a certain way, the next question won't apply to them and you will skip it on purpose. In that case, you'll circle 9, so that the person reading the survey knows that question was skipped on purpose. So let's get started with the questions. The first question is a screener to make sure that our participants fit the criteria of being someone who used an illicit drug in the last 3 months. So once you get verbal informed consent, the first thing you will ask is, in the past 3 months, have you used an illicit drug, meaning a drug that is illegal or had not been prescribed to you? Most people are probably going to say yes. If someone says no, doesn't know, or says they don't want to respond, please say, thank you for taking a moment to speak to us. We are only administering this survey to people who have used an illicit drug in the past 3 months, so you do not need to answer any further questions. And you can end the survey there. If they say, oh, 1, yes, you'll circle that and move on to the next question. How old are you? And you'll fill in their 2-digit age in the boxes like this. If someone is younger than 18, you'll have to end the survey because they're not part of our target population. And you'll say, thank you for taking a moment to speak to us. We are only administering this survey to people who are 18 and older, so you do not need to answer any further questions. How would you describe your gender identity? Circle the answer that applies to them. If they respond with an identity that's not listed here, you can circle 04 and write it into that blank space. What is your race or ethnicity? This type of survey question is called mention, not mention, and it allows us to record multiple responses for a single participant in a single question. We're using this type of question here so we can capture people who are bi or multiracial. So if you ask, what is your race or ethnicity, and someone says Black and Latina, you can circle both of those responses as mentioned, and then go through and circle everything else as not mentioned. Question 5 is, in the past 3 months, where have you spent the night most often? This is an open-ended question. You're not going to read them the options below. You're going to pick the one that sounds most like what they respond. So there are a few prompt options. For example, if the respondent names more than one place, you can follow up by asking, which of those places have you spent the night most often in the last 3 months? Or if you want to confirm their answer, you could say, sounds like you're describing a park. Is that correct? And also, please note that between number 6 and 7, there's a distinction between the respondent staying in an apartment that belongs to someone else versus staying in an apartment where they pay rent or have their own lease. So if the respondent just answers a house or an apartment, please ask the follow-up prompt, do you pay rent for that apartment or do you pay rent for that house? And you'll circle the response that is most like what they've described. Question 6, and we're going to see for the first time that 9-7 skip option. So question 6, in the past year, have you been admitted to an emergency room, meaning you received medical care in the ER? If they said no, then we wouldn't ask 6A and 6B about those admissions because they didn't have them. So instead, we would select 9-7 for both of those and just skip those questions. Or if the person says yes, they were admitted and received medical care in the ER, you would follow these instructions and ask 6A and 6B. So you'd ask the next question, 6A, were any of your admissions due to overdose? And 6B, were any of your admissions due to injection-related infections? And circle their responses. Question 7, in the last year, were you arrested or incarcerated for having, using, or selling drugs? Circle their response. The next series of questions is going to be about the respondent's drug use, and we want to prep them for that by reading, we are trying to understand what drugs people are using, how they use them, and where. I'm going to ask you several questions about your drug use. First, I'm going to name some different drugs, ask if you've used them in the past 3 months, and ask if you used them more than once a day, a few times a week, or less than once a week. And we're going to ask that question using this chart here, which looks complicated, but it follows a pattern, and you're going to get the hang of it, and it's going to be super easy. So the first part of the question is this part 8. In the past 3 months, have you used, and you're going to drop down to each item on the list, read it, ask yes or no to whether they've used it, and if they say yes, you're going to move up to this part little a and ask how often. So for example, in the past 3 months, have you used methadone? They said yes, so you ask, in the past 3 months, how often would you say you used methadone? And you go back and fill in the name of whatever line you're on. So you ask, in the past 3 months, how often would you say you used methadone? And maybe they say, I don't know, every once in a while, which doesn't fit into one of these 4 categories of more than once a day, a few times a week, or less than once a week. So as you can see, we have a prompt here. So you can ask them, would you say more than once a day, a few times a week, or less than once a week? And when they answer with a response that fits into one of the 4 categories, you can circle it and move on to the next one. So for the next one, in the past 3 months, have you used alcohol? Yes. In the past 3 months, how often would you say you used alcohol? They'll respond, you'll circle their answer. So for the next one, if they said no, they hadn't used marijuana in the last 3 months, you would circle 9, 7 in part little a to indicate that you're purposefully skipping that question. You're not going to, if they say no, they haven't used it, you're not going to ask how often. You're just going to move to the next question. So for example, if you said in the past 3 months, have you used marijuana? And they said no, you would just move straight to the next one. In the past 3 months, have you used synthetic marijuana? And if they say no, you'll skip that one too, and you'll run through all the questions. In the past 3 months, have you used cocaine? In the past 3 months, how often would you say you used cocaine? In the past 3 months, have you used crack? How often would you say you used crack? In the past 3 months, have you used heroin? How often would you say you used heroin? In the past 3 months, have you used meth? They said no, so we're not going to ask how often. We're going to skip it. They said no to downers, so we're going to circle 9, 7 and skip that one also. This last one I want to go over because there's an extra question at the end. So in the past 3 months, have you used opiates other than heroin? And if they need it, you can prompt them by saying such as OxyContin, Vicodin, Percocet, or morphine. This person said yes, so we move up to 8 lowercase a and ask, in the past 3 months, how often would you say you used opiates other than heroin? And when you circle that answer, they said less than once a week, and so you circled number 4, and there's another instruction there to ask part I. So you'll drop down to part 9I and say, were they prescribed to you? And ask if those opiates were prescribed to them and record their answer. See, not so bad. In question 9, we only want to know about injection drug use, and you'll let the respondent know by saying, I'm going to now ask specifically about injecting drugs. In the past 3 months, have you injected an illicit drug? If they say yes, you'll be instructed to drop down and read questions 9A through C. If they had said no, you would circle 9 sevens for all of those and skip them. You wouldn't read them because questions about injection drug use won't apply to someone who hasn't injected an illicit drug in the last 3 months. So since this person said yes, we'll move to 9A. On average, how many times per day did you inject drugs in the last 3 months, or did you inject less than once per day? If they say less than once per day, you'll circle 0. But if they give you a number of how many times per day, you should write it into the blank space provided. 9B, in the past 3 months, how often has anyone helped you inject? For example, helping you find a vein or injecting for you. Would you say someone has helped you inject rarely, sometimes, usually, or almost always? So here, since there's that ... ellipses, and the question mark doesn't come until after option 3, that tells you that you should read all these options out loud so the person knows what they should pick from. So again, would you say someone has helped you inject rarely, sometimes, usually, or almost always? And circle their response. You'll set up question 9C by reading, I'm going to read you some items you might use to inject drugs and ask if, in the last 3 months, you have reused these items after someone else already used them. So you'll take that first part of the question that's next to number 9C and fill it in to read down the list A through E. So for example, in the past 3 months, did you reuse a syringe or needle? Did you reuse a cooker or spoon? How about a cotton? In the last 3 months, did you reuse water after someone else had already used it to inject? In the last 3 months, did you reuse any other equipment for injecting drugs? And if they had said yes to letter E, you have a blank space there to ask what other equipment did you reuse and fill it in. Next, I'm going to ask specifically about smoking drugs. In the past 3 months, have you smoked an illicit drug? In this example, the person said no, so we fill in 9 sevens for question 10A, so we know that was a legitimate correct skip. If the person had said yes, you would follow these instructions and drop down to part 10A and use the same technique that you used in question 9C that we just went over. For question 11, we're going to do a similar thing to some of the previous questions about types of drugs or types of equipment, where we're going to repeat that first half of the question and ask about several different options, asking the participant to say yes or no. So the question will run something like this. We are trying to understand where people are using illicit drugs. I'm going to name places where people might use drugs and ask you to say yes or no to let me know if you've used drugs in that place in the last 3 months. In the past 3 months, have you used drugs in a street or park? How about in a stairwell? In the past 3 months, have you used drugs in an abandoned building? How about in a public restroom, like in a restaurant? In the past 3 months, have you used drugs on public transportation? In a car? How about in the bathroom of a syringe exchange program? Have you used drugs in a shooting gallery in the last 3 months? Have you used drugs in someone else's home? Have you used drugs in your own home in the last 3 months? In the past 3 months, have you used drugs in any other place that we haven't mentioned yet? And if they say yes, you would have a blank space there to write in the response, or if they say no, you can skip it. So this person said yes to 5 different places, and for question 12, we want to know which of those 5 places in which of those 5 places have they used drugs most frequently in the last 3 months. So for question 12, you'll say, of those places I just mentioned, which are the 2 where you used drugs most frequently in the last 3 months? And you will write in the letters that correspond to their responses. So this person said, I use drugs most frequently in a park and in my own house. If the person has given a bunch of responses and perhaps can't remember all of the options that you read through, because there are a lot, you could read back the things they said yes to. So for this person, if they said, I don't know, you might prompt them by saying, well, you mentioned that you had used drugs in the park, in a public bathroom, in the bathroom of your syringe exchange, in someone else's home, and in your own home. Of those 5 places, in which 2 did you use drugs most frequently in the last 3 months? And see if that helps prompt them to be able to give you 2 answers. Question 13. Please think about who has been with you when you have used drugs in the last 3 months. Would you say you've used drugs almost always alone, sometimes alone, usually alone, or almost never alone? So this question, you're going to read through all the responses, and it's a scale from almost always alone to almost never alone. If they answer the question in relation to when they're with friends, so maybe in response they say, I don't know, I usually have friends around, you can read through the responses again and ask them to answer with one of the 4 options that you provide. If you've used drugs in public, for example, in a street, park, or public restroom in the last 3 months, how often have you worried about being arrested? Would you say that you worried about being arrested rarely, sometimes, often, or almost always? If they say in response to that they have never used drugs in a public place or haven't used drugs in a public place in the last 3 months, you can circle 9-7. Otherwise, pick the response that they name. 15. In your life, have you ever used drugs so strong they caused you to overdose? If they say yes, you'll be instructed to drop down and ask 15A, have you overdosed within the last year? In the past year, have you witnessed someone else having an overdose? Do you know what Narcan or naloxone is? If they said no, you would skip 17A and circle 9-7. If they say yes, you ask 17A. If you wanted to get a Narcan or naloxone kit, how easy or difficult do you think it would be to get one? Do you think it would be very difficult, somewhat easy, or very easy? Circle their response. This last part of the survey is about safer drug use spaces and how people feel about the idea of this new program. So the questions will run something like this. Now we are going to ask you a few questions about a potential new program. Safer drug use spaces are places where people can use illicit drugs. They provide sterile equipment and have staff trained to treat overdose. People cannot be arrested before, during, or after using the safer drug use space. They also have other services like running water, social service referrals, educational resources, and support from staff. If New York had a safer drug use space, do you think you would use it? Do you think other people who use drugs would use it? This is our last question, question 20, and it's another mention, not mention question. So question 20 is, what do you think might be some benefits to using a safer drug use space instead of using drugs somewhere else? Please name as many benefits as you can think of. And you'll give the respondent some time to think, and you'll circle any of these options, A through M, that match the ideas that they come up with. And if they come up with ideas that aren't on the list, you can write in responses in spaces K, L, and M. So for this question, you'll listen to what the person says and circle whichever options most closely match what they say. So for example, if the person said, I think I could get clean syringes at a safer drug use space, you would circle B. If the person said, I think if I was using drugs in a safer drug use space, I would be less worried about getting HIV, you would circle F. And maybe the person said, oh, I heard that staff at safer drug use spaces have naloxone, so I think that if I overdose there, I would be safer. And you would circle H. If they gave you those three answers, maybe pause for a second, you could prompt them by saying, can you think of any other benefits? And if they've got nothing else, then go through and circle not mentioned for every single thing that they haven't said. And that way, when we're reading the surveys afterwards, we know for sure that they only said those three things, and they definitely didn't say the others. They weren't not circled by mistake. Question 20 was our final question, so you can close off the survey, say something nice like, that was the last question of the survey. Thank you so much for taking the time to speak with me. Do you have any further questions? And if they have further questions that you can answer, great. If you don't know the answer, or if they want to speak to me about the survey for any reason, my phone number and email address are on that study information form that you give to them. You can tell them that they are welcome to call the research coordinator, me, at any time, or you can call me on their behalf. We want to make sure that everyone leaves feeling great about their participation. And again, please thank them profusely, as we weren't able to offer incentives or compensation for their time. Let's go through some quick survey tips to help you as you're asking these questions. So first, pause. Give people enough time to think through the question, to think through the answer choices. You've asked and heard these questions a bunch of times and know what's coming, but for people taking the survey for the first time, they might need a few seconds to think through the answers. So after you've given a nice long pause, if they still haven't answered, you can reread the answer options or go to the prompt if there is one for the question. If a respondent gives more than one response to a question where you can only record one response, or gives a response that isn't one of the answer options, you should reread all the response options again and maybe prompt them by saying, which one of these would you say applies? So please read all the questions just as they're written. If someone's stuck or confused, you could reread the question again or repeat the answers, but please don't rephrase the questions or the answers, because if you rephrase it and the question turns into something slightly different, it can mess with our data. Also, make sure you fill out every single question. Don't leave any blank. We'll do one more review of those 9 7s, 9 8s, and 9 9s at the end, so you can fill something in for every question. But if you leave a question blank, we're not going to know what happened there. We won't know if you accidentally skipped it or if the person said, I don't know. So please circle something or write a note for every single question. Please practice as much as you can with friends and coworkers before you administer the survey to a respondent. That's going to help you get familiar with the questions, know which things you read out loud, know which things you just read to yourself, and it'll make things go a lot smoother. Also, lastly, feel free to annotate and take notes in the margins of the survey if you want to. So if a question keeps confusing people and tripping people up, note it in the margins, and when I read all these surveys, I'll see that and I'll know that maybe in the future we need to change that question. Or if someone gives a response or makes a comment even that you think is interesting, jot it in the margins, and it won't necessarily go into the data set, but it'll be good for us to know. So one last review of these 9.9, 9.8, and 9.7 responses. If a respondent refuses to answer the question, you fill out 9.9, no response. Also, if someone, say on question 11, decides they don't have enough time or they're frustrated and they don't want to take the survey anymore, that is completely allowed. The survey is voluntary. So if they stop taking the survey in the middle, you would fill the rest of the survey in with 9.9s and maybe write a note at the bottom that says that the person decided they didn't want to do the survey anymore, a note why. 9.8 is when someone says, I don't know. If they really don't know, they answer to a response. There shouldn't be a ton of these. We hope there aren't a ton of 9.9s either. But if someone does say, I don't know, even after you prompt and reread the question, circle 9.8. And lastly, 9.7s. Those are those legitimate skips, when you skip a question because it doesn't apply. So maybe you asked about their ER admissions, and if they said they hadn't been to the ER, you wouldn't ask those follow-up questions. You would circle 9.7 and skip them. So what happens after this training? First, I'll be shipping hard copies of the survey and information sheets to you. Then November 7th to 23rd, you'll do the data collection and administer all these surveys. And during that period when you're collecting the surveys, please keep them in a secure place. So keep them in a locked office, keep them in a locked drawer. We want to make sure that only you all who have gone through this training have access to the survey data. Once you've collected all the surveys, you'll scan them and email them back to me, and I'll be in touch with instructions about that. And I'll also be reaching out to arrange to have the hard copies shipped back to New York. I'm going to need some time to enter all this data and analyze it, but after that happens, we'll be in touch to share back the data that you collected from your state, from your city. So thank you so much for your time, both just now during this training and during all the surveys you're about to conduct. Again, my name's Alison Sutter, and I'm the student researcher coordinating this survey. My email address is here, and my phone number is 847-899-9037. You can call me anytime if you have questions at the end of the day about what happened, if a participant asks you a question that you don't know how to answer. During that survey period, please call me anytime with any question. I'll do my best to get back to you as quickly as possible. All right, have a good one. Bye.